I'm Jennifer Blomquist. Welcome to HealthLine. I'm so glad you joined us tonight. Whether you're a regular viewer or perhaps new to our program, I guarantee you will learn something. It's always an interesting program, and we are live here in the studio, which is why we have the phone number at the bottom of the screen, because we have a guest tonight. We have a foot and ankle surgeon here to answer any of your questions regarding that specialty. So if you want to call and ask the doctor a question, that's the number to call. It's 969-2720. If you're outside of Fort Wayne, still a free call as long as you put an 866 in front of there. And just to quickly remind you, you have two options when you call in. First of all, you'll talk to a very nice call screener. We don't just throw you on the air. And you can let the call screener know if you want to ask your question live. I like that option the best because you can interact with the doctor. You can talk back and forth. He may need some more information from you to better answer your question. So that's a great option. Or another one's perfectly fine if you prefer that I ask the question for you. So just relay your question to the call screener and they will let us know what you want us to ask. So call sooner rather than later. I'd hate for you to miss the opportunity to get your question answered tonight. So let's go ahead and meet our guest. He's returning, which so glad to know we didn't scare him away the first time. This is Dr. Stephen Douthett, who is a foot and ankle surgeon. And he brought some props which is very helpful because a lot of us don't really think about what the inside of our foot really looks like. So thank you, doctor, for coming back.
Thanks for having me.
I know to begin with, and again, if you have a question that's not related to this specific topic, it's okay to call in, but we're going to start talking about things like arthritis of the foot and ankle and also injuries. So I know a lot of people as they age, and I can attest to this, sometimes it just gets really painful to walk. And it may not be every day, but I've also heard a lot of people get, arthritis here and there. So I don't know if you want to talk about what causes it.
Yeah. So there's multiple types of arthritis. There's wear and tear arthritis, which is the most common. This is going to be the patient as they age, they start to wear out some of the cartilage. They develop arthritis, is what it's called, and that's the typical aging arthritis. Then there are different types. There are autoimmune diseases like rheumatoid arthritis, there's gouty arthritis, so just different types of arthritis. And then another common one in the foot and ankle is called post-traumatic arthritis. So post-traumatic arthritis is arthritis that develops in a joint after an injury years ago, and it damages the cartilage and can wear and tear as time goes on.
One thing I hear some older adults say is, I played all these sports when I was younger. I was so active. And they feel like a lot of them will say, now I'm paying the price for it. I know you have children, so do I. And I think, is there something I could do to prevent them, because a lot of kids are very active today and on their feet a lot. Is that just a really common thing that you kind of quote unquote pay the price for what you did when you were younger? Yeah,
I mean, obviously, if we're active when we're young, it's not going to necessarily mean that you're going to develop arthritis. However, if you have injuries when you're younger or repetitive ankle sprains, for instance, that can lead to arthritis, as time goes on. The best thing to do in those cases would be, supportive footwear, so wearing, proper shoes when you're doing activities instead of, playing football with friends in flip-flops, you're going to be wearing a shoe. Or if you have sprained an ankle, doing the proper rehab, not just jumping back into the sport without wearing a brace or having your ankle taped, that type of thing. So.
Well, what are your options with the arthritis? And I don't know if you want to use the model to show, can you get it in all different parts of the foot, or is it more common? I've met someone who said they have it in their toes. Yeah.
So arthritis is it's basically a disease that can happen in any joint. However, in the foot and ankle, we have a lot of specific parts that can wear out. The most common joint that we see it in the foot and ankle is actually this first joint here. It's called the first metatarsal phalangeal joint, and that's the big toe joint. Essentially, when we're walking, about 85% of your body weight goes through that little joint. So any old injury or any altered biomechanics, so if someone has a bunion where this joint is slightly deviated, basically turned sideways a little bit, that can lead to some wear and tear arthritis, and that's a common place to develop it. Another place in the foot to develop arthritis is what we call the midfoot, and it's just like it sounds. So this is right in the middle of the foot. We have a bunch of support joints in this area, and they can wear out either from prior injuries or just wear and tear, and that's another place that we see it oftentimes in the foot itself.
Now for the ankle, would that be more typical of
Yeah.
To have it because of an injury?
Yep. So
more so than wear and tear?
Yeah, exactly.
Okay.
So about 75% of the arthritis that we see in the ankle is what we call post-traumatic. So a lot of times we see people that have sprained their ankles several times growing up. They have fractured their ankle years and years ago, and then that cartilage was damaged initially, and then it slowly wears out, and then we get post-traumatic arthritis. So that's when we get ankle arthritis, yeah.
Now, I know that it's not that it's a joke, but if you break a toe, people are like, oh, they're not going to do anything.
Yeah.
But I know one time I broke a toe and it hurt, like I couldn't sleep for days. So I finally went to go see somebody, and they told me just to tape it, and they gave me like an orthopedic shoe to wear.
Yeah.
But I mean, I feel like most people kind of blow it off because they you'll hear someone say, oh, they're not going to do anything for a broken toe. But is that true?
Yeah,
or?
well, I mean, all fractures come in different flavors, if you will. So even a toe fracture can be displaced enough that it needs to be what we call reduced or put back into place. Or if a joint is dislocated, sometimes it just needs to be numbed up and put back into place. So, even when it's a toe fracture, I think it does warrant being seen, getting a radiograph or an x-ray, and making sure that you're doing the proper treatment, because even these little things can really, cause pain as time goes on if they're not dealt with properly.
Yeah, I mean, this is years ago. My kids are in college and high school now, but I tripped over. They were into garbage trucks, and I was running to grab the phone. This is when we had the phone on the wall, not the cell phone. And I tripped badly, and like I said, it was really painful.
Yeah,
So I went in to finally, after like 3 days, to get it checked.
Yeah.
Is there anything surgical-wise that you can do for arthritis, or would most of it be just a medication or a cream? I don't know if a cream would work.
So obviously it's joint dependent, but for instance, in the big toe joint, if you develop arthritis in that joint, we go through both conservative and surgical treatments. The conservative treatments would be a shoe that's supportive and more stiff, so the joint's not bending as much, because that motion, that wear and tear can really lead to increased pain. And if we've got a nice stiff shoe, the toe joint doesn't have to bend as much. The other conservative treatments would be the classic anti-inflammatories, ibuprofen, that type of thing.
Yeah.
Injections are an option. They typically aren't very effective in these joints because they're so small, and you're using it so often that it wears off pretty quickly. And then the end result is surgery oftentimes, and it depends on how bad the arthritis is. So there's different stages of arthritis in this joint. So if it's stage 1 or 2 or early arthritis, sometimes we just do a cleanup. So we essentially do an incision and clean up the joint, remove the bone spurs, if you will, and then keep the joint moving. If it's more severe arthritis, then we end up doing, there's 2 different procedures. One is a joint replacement that can be done in very specific cases that allows for some joint motion. And then the gold standard, if you will, is to fuse that joint. So if that joint is fused, the joint in front of it still bends just fine. So when we're walking, it still can move. However, it gets rid of the arthritis in this joint, and by fusing it, the pain then goes away because it's not grinding anymore.
All right. I'm really glad you brought that model. That is very helpful. So thank you. I just want to remind everybody, we haven't had any calls yet, but this is kind of the trend. A lot of people wait until later in the show to call, but I do hope you'll call sooner so that we don't miss your question. Again, we keep that phone number up at the bottom of the screen. It's 969-2720. And if you're outside of Fort Wayne, it's a toll-free call. Just put an 866 in front of there. We're talking about arthritis of the foot and ankle, and we're going to be talking about injuries. But if you have something else related to the foot and ankle, this is your guy to ask the question. So feel free to give us a call. What about like any, you're talking about conservative remedies, just even like icing or elevating creams? I mean, I know there are some arthritis creams. I don't know how effective those would be on the foot.
Yeah. So obviously, if you have an acute flare of arthritic pain, icing and anti-inflammatories, rest ice, compression elevation is a good idea to get that flare kind of calmed down. There are topical creams, so there are medical creams that you can use that are anti-inflammatories, and then there are more analgesic creams, so numbing agents and agents that can kind of cool the skin, and that can help with discomfort as well.
Sure. All right. Yeah, if every step hurts, you're going to think about it
every
through
step
your
you
day.
take.
Yes, exactly. What is next to it? You were showing that's is this the device that's next to
Oh,
it?
yeah.
Is
So this
that,
is for a broken ankle, essentially, that,
Okay.
that we're looking at there. So there is a lot of anatomic hardware is what we call it. So there are specific pieces of metal and plates and screws that are designed to go in specific bones, and this is just an example of a plate for an ankle fracture. So
Okay.
the plate is designed to contour the morphology of that fibula, or the outside bone on the ankle, and these little baby screws essentially hold it in place. So when the bone is healing, this is kind of a buttress that'll support it.
now if somebody needed to have that done, would that last? Can that last for a long time, or do you ever have to worry about
Yeah.
having it repaired
Yeah, so
again?
the goal with these newer, we call them anatomic or bone specific plates,
Yeah.
is that they are less irritating, and hopefully they can stay in forever. The plates are only 1 to 2 millimeters thick now, so they're
Okay.
very, very low profile. So oftentimes you can't even feel them,
Yeah.
and if you can't feel them, they're not going to rub on shoes. They're not going to cause
Yeah.
that irritation, and they can usually stay in.
Okay.
There are cases that those plates still can cause some irritation, and we remove them, but the vast majority can stay in.
Okay, yeah. Nobody wants to have surgery
Yeah.
once, let alone a second time.
Correct.
So
Yeah.
we did have a gentleman call in, and I think he's going to ask the question live. Are you on the line, Fred?
I am.
Oh, thank you, Fred, for calling. Go ahead and ask Dr. Douthett your question. Oh, go ahead, Fred. And you might want to turn the sound
Okay.
down on your TV because there will be a little bit of a delay.
Okay.
Sorry about
A
that.
number of years ago, I had a break in my left leg, the tibia and the fibia. And some years after that, I developed arthritis below that break in my ankle. Is that typical?
Yeah. So when you break your tibia and your fibula, which are the leg bones, essentially what that can do is change the orientation of the ankle joint. So it can change the alignment, if you will, just like a car. So if the alignment's off in your car, you're going to wear out the tires quicker. The same thing happens with the ankle. If the leg is broken higher up and it's not perfectly aligned when it heals, that alignment will lead to wear and tear of the arthritis, and that ankle can wear out and develop that arthritic pain that you're talking about.
Fred, did you want to ask anything else?
No, thank you very much.
Of
Okay, thanks for calling, Fred. Yeah, I didn't think about that. If you broke other bones, that it could impact what's
Yeah.
below it in the structure.
If the alignment's off, it definitely leads to abnormal stresses in the
Yeah.
joints. Yeah.
All right. And again, if you want to do what Fred did, that's a great way to get your question answered. You can talk live to Dr. Douthett on the phone, or feel free to call that number, and then I can ask the question for you if you prefer to do it that way. I do see a lot of people walking around with those boots on, you don't want to stop them, but you think, oh man, I wonder what happened. That just
Yeah.
looks like it's no fun.
Yeah.
Is that typically what a person's going to wear after having surgery on their foot or ankle? And some of them I see in a boot and they're on the crutches.
Yeah. So you're talking about a cam boot or a fixed ankle walker, and that's it's a common device that we use to immobilize a body part while giving the patient freedom to remove it and work on some range of motion. But yeah, a lot of injuries end up in a fixed ankle walker. A lot of surgical patients end up in a fixed ankle walker. And then they can end up in it just from the actual definitive treatment. So there are fractures of the foot and ankle that can be treated without surgery, and those are typically immobilized in a boot walker, and then as it heals, we advance them back into normal shoe wear.
Yeah, do they even use casts anymore, really? I don't see that very often.
Yeah, we still use casts.
Okay.
Usually that's a first step in severe ankle fractures or hindfoot fractures or hindfoot fusions that we're doing. But we're trying to get patients out of them as quickly as safely possible. We found that getting joints moving if they're not fused or getting the body mobilized quicker is more beneficial.
So if you need to have surgery on your foot, in general, how long of a recovery is that? And I assume there's probably some physical therapy down the road after that?
Yeah, so it really depends on what's done. For instance, like we were talking about earlier, if the big toe joint is fused for arthritis, typically my protocol is to let them start walking in that boot walker.
Yeah.
Usually they start walking that same week in the boot walker, and we keep them in there for about 6 weeks. That's what it takes for a bone generally to fuse or to heal, and then we can get them into shoe wear, and actually physical therapy is not necessary for a lot of those procedures.
Okay.
If the patient's gait is still thrown off, or if they have a lot of stiffness afterwards, then we do send them physical therapy for that particular procedure. But fractures and other injuries definitely require physical therapy afterwards.
Yeah.
But the timeline's usually about 6 weeks to immobilize someone, then kind of get them moving from there.
And I assume the younger you are, the faster you're going to heal. It seems like when you get to be my age, it starts to take a longer time for that stuff to take place. And then a lot of times with somebody, I'll see people also on those, I don't know the specific name for it, it's like a cart.
Yeah.
So what would be the benefit of that versus just maybe being on crutches?
Yeah, so I don't know if you've used crutches recently, but they are
Not for a long time. They're no fun.
Yeah.
They hurt. It really hurts your underarms after
Yeah.
doing that all day at like school or work.
Yeah. So I tell my patients that after 30 years old, crutches they're miserable. The knee scooter allows patients to move around a lot quicker, a lot more efficiently, and usually safer than with crutches. The crutches are still handy in tight quarters if you're trying to navigate through your home. But the knee scooter is just a better way to get around, and it's a newer thing.
I was going to say, you never used to see those before. I mean, kids really think they're fun. I remember, seeing like sometimes there'd be at one of our kids' ball games, a grandparent who needed it, and then when they're sitting, there are the kids running around with the scooter. But so it's kind of the break-off age is about 30.
That's my own personal
is that?
feeling.
Okay.
Yeah.
No, crutches are definitely no fun.
A little bit more friendly to use.
Sure, yeah. Well, there have been a lot of advancements too. So it used to be you'd have a long hospital stay when you had a surgery like that. And now I don't even know, would you even have an overnight stay typically?
Typically, most of the foot and ankle procedures that we do, almost all of them are outpatient or day surgery. So the patient will go home the same day, and they won't require any type of hospitalization for these procedures. If there's other health factors that are playing in, then yes, an admission may be necessary, but it's quite rare.
I was just writing an article about just the explosion of ambulatory surgery centers. Now there's so much, especially in orthopedics, where they just want, it's just a one-day thing. And they were talking about all the things like it's less expensive, and it's just easier on the patient. And I think they kind of had the mindset that everybody who works in these places, they just are tight knit, and it's just it's a really well-oiled machine. So if
it's a facility that specializes in nothing but orthopedics, that's all they know. Some of my partners are doing outpatient joints, so the patient has a knee or a hip replacement and can go home the same day in certain cases, and that's pretty remarkable.
Yeah, I think most people would much rather recover at home than in a hospital for sure. So we want to welcome your questions again. So we have less than 10 minutes, believe it or not. The show goes quickly. So it's 969-2720. Again, still a free call if you dial 866 in front of there. We only have Dr. Douthett a few more minutes. We could still squeeze in a question or two. And in fact, we are getting one right now from a woman named Barbara. Let's see, she wanted to know if there are any surgical procedures with foot drop. Now, what is foot drop?
So foot drop is typically caused by an injury to the nerves that lift up the foot. So it's just like it sounds. It's when a patient can't lift their foot when they're walking.
Like I've seen like a drag.
And it's a tripping hazard. And there are both surgical and non-surgical options for those patients. The non-surgical option would be a brace called a AFO, or ankle foot orthotic, and it basically kind of holds the foot up. A lot of them are carbon fiber and have almost like a spring built in, so the foot kind of recoils upwards. And then there are surgical options for those patients as well. the patient would need a different muscle or tendon in the foot to still work. So a lot of times I end up taking a tendon called the posterior tibial tendon, which is generally used to support the arch, but in those patients that muscle still fires, and I can reroute it from one side of the foot around the back and then into the front of the foot, and it then fires to lift the foot upwards. It's not as strong as someone's native tibialis anterior, or the muscle that lifts up that foot, but it is a life-changing procedure for those patients that have been kind of dragging the foot, and when that's a possibility, it works well.
And it seems like I usually see older adults with the foot. It happened to my uncle just out of the blue.
Yeah.
And he ended up having surgery for it. I'm not exactly sure, this was years ago.
Yeah,
but
a lot of times it's like a bulging disc or a herniated disc that leads to it. It pinches the nerve that provides, that motor function to the foot and ankle, believe it or not. And sometimes that damage is permanent that has happened to the nerve at the back. And in those cases, we do the tendon transfer if the spine surgeon's not able to get it to return to normal function again.
Sure. Oh, that's just horrible to think, to have to walk like that too. It looks so cumbersome.
Yeah.
So we do have one more question here from Pat. Wanted to know, can toes hurting be a sign of arthritis?
Yeah, definitely. A lot of patients with arthritis, specifically in the toes, would have a sensation of the toes being, really, really stiff. They don't bend very well anymore. And a lot of people will describe the pain as almost like a toothache, but in the toe. So it's like a kind of a deep aching pain that's sharp, and it usually starts to subside when the joint really gets moving, and then flares up after they're really active again, and that type of thing.
Do would you notice anything on the exterior of your toes if you had arthritis? I don't know if they swell or look.
Yeah.
If they look, how things when they're infected kind of look kind of red.
Yep. So it depends on the joint. Obviously, the toes are very, very small, body parts with not a lot of soft tissue. So any type of bone spur just basically makes a prominence right on the top of the toe, and you can see that. A bone spur is essentially a buildup of bone that happens from the grinding, and a lot of times we'll see that on the big toe joint. So we will look at that patient, and before the patient even will tell us what's going on, you'll see the big hump on top of the toe joint, and it's an obvious sign. That's where it's coming from. So and it can be erythematous or inflamed and red, swollen, that type of thing when it's really really bothered.
What options would you have for that bone spur then? What would they?
Yeah, so typically...
Are there non-surgical ways to treat it?
That's really going to be trying to avoid pressure. So in lacing your shoes, you can skip a couple laces if it's on the middle of the foot and try to prevent pressure in the area. But unfortunately, that bone spur doesn't go away until someone removes it in the case of arthritis.
Okay, all right. I didn't know if there was something a little easier. So.
No, not a good cure to get rid of it other than avoiding pressure for those cases.
And then, we just have a little bit of time left, maybe like a minute. Any advice to people about buying shoes? Because we've had foot specialists come on here, probably some of your cohorts, and they're just like, don't look what I'm wearing, but flip flops. They don't like it when they see me walk in here in flip flops. Yeah. But I think people put the look of the shoe in front of the function. For sure. Yeah.
Yeah. My go-to is essentially, you're not married to a shoe, so you can wear your flimsy shoes when you're at home and you just want to kind of lounge around. Sure. But typically, if you're going to be active, I would wear an athletic style shoe that is not flexible. One of the first things that I do,
like a cross country type of thing.
Yeah, just shoe. A nice sneaker.
Okay.
One of the first things I do when patients come in and they've got pain is I look at their foot, or at their shoe wear, and if I can take that shoe and fold it in half with just a couple of fingers, it's not supportive enough. Okay. It's just putting too much pressure through the foot.
Okay, all right. And sometimes those supportive shoes are more expensive, but I guess you have to look at it as an investment.
Yeah,
exactly.
Yes.
I'm going to try and quickly take a call from a gentleman who called in named Bruce, and he said, can walking long contribute to developing arthritis?
I guess at the extreme level, yes, but walking is actually good for joints. It's a low impact activity. Generally, walking itself is not going to wear out joints, so I don't think that would be something to worry about. Obviously, if there's a lot of hills or uneven surfaces and you roll your ankle, or if you're walking beyond the point of your body really holding up, then yes, it could be bad for it. But
Sure.
that's a rare instance. So walking would be good for arthritis. Yeah.
All right. Yeah, I know there's that big move to get people on the go.
Yeah,
Keep them moving.
Motion is lotion.
Yep, that's true. All right. Well, thank you so much, Dr. Steve Doughton. I really appreciate your Douthett, excuse me. Thank you so much for coming on the show. I appreciate it. Thank you so much for bringing the models. I think it's exceptionally helpful. So, and we hope that you'll join us again next week. There'll be another HealthLine, same time, same place. I'm Jennifer Blomquist. Take care. Have a great night and have a good rest of the week. Bye-bye.
The preceding program on PBS Fort Wayne was made possible in part by
Momentum, progress, innovation. Parkview Health knows standing still isn't an option. We must learn, grow, excel, and actively work to advance healthcare for our community and beyond. With technologies that improve access to care and teams of specialized providers, we are moving healthcare forward. Right here at Parkview Health.